the meeting's called to order. The first item on the agenda is the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Next on the agenda is the approval of the minutes. Are there any corrections?
The minutes have been critiqued. Minutes of the special meeting that we had to address health and safety issues of concern regarding artificial turf. That meeting was held on March 14th, and the prior month's Board of Health meeting on February the 28th. It's been critiqued, and I make a motion that they are approved.
Is there a second? Second. Been moved in second. All in favor?
Aye.
Aye. Any opposed? Meeting minutes are accepted. We'll move on to the next item, which is public hearing. We do not have a public hearing. We have old business, department reports. These are informational.
Mine's going to be verbal. Caroline has hers, and Stephen hasn't been here long enough to have one yet.
Would you like to start?
Yes. So obviously this past month, we had a special meeting at the request of the planning board to get a Board of Health opinion. That opinion has been rendered through our March 14th public hearing. I did draft the opinion per the board's request and submitted that to the planning board. Copies of the opinion are in your packets. Aside from that, we do have a new hire. Stephen Casey Jr. is the new public health inspector for the town of North Andover, so welcome. Great to have you. Thanks. Believe me. And aside from that, just getting everything ready for this meeting and moving forward with septic. Still doing the plan reviews for the food. Talked to Megan this past week. She's also going to be coming in to help out and bring Stephen around to some of our restaurants and establishments to show him how her inspections are performed and get him up to speed on the food. He's already started working on some of our Title V and some of our septic installations and inspections and letters. And that's it for now.
Okay. Anything else to add?
So I've had kind of a slow month. There hasn't been too much going on. We participated with the Senior Center's health fair that was on Monday, and we did cholesterol screenings there, and that was successful. There was a fair amount of people that came through. I've had clinics, as usual, blood pressure at the Senior Center and senior housing, and have started vaccinating with the new shingles vaccine, Shingrix, and have received our second order and continue to just take a list of people who are interested in the vaccine and kind of have them on a wait list. As we get it, we start vaccinating and kind of move from there. Yeah, so and then we got a new vaccine refrigerator, which is exciting. So we had a standard kitchen refrigerator, so now we can kind of expand what we offer for vaccines, because state regulations state that you have to have a pharmaceutical grade refrigerator in order to receive state vaccine like MMR or varicella. And so as we kind of move forward, we can hopefully start vaccinating and have those as options as well.
Any questions on the departmental reports? Okay, hearing none, we will move on. We have already addressed new business, unless you wanted to say anything further.
I want to welcome Stephen to the health department and as a member and agent of the Board of Health. So I think it's great to have you on board. Believe me, it's been a long time coming. And
Can't tell if you're excited.
Yeah, absolutely. I've just been throwing stuff at him for the past 3 days. So welcome. And any board members have any questions or want to say anything?
Very happy to have you. Well,
I'm happy to be here.
all right. Well, we will move on to our communications, announcements and discussions. First up is Northeast Mosquito Control. Welcome. You have the floor.
So I'm Kimberly Foss. I'm the entomologist for the district, and this is William Mahaffey, Bill. He's our operations manager.
We came here tonight to go over a quick PowerPoint to introduce ourselves to some of the new members and to just give a brief overdraft of what we did last year and what we continue to do for you during the course of the upcoming year. I need this. See if this works. Yes. So just a quick summary on the 2018 arbovirus activity for the state. Eastern equine encephalitis is another encephalitic infection. It is more risk. It has a higher risk for humans than West Nile virus. We're looking at that possibly coming back into the district in a few more years. We're seeing populations of the primary mosquito responsible for transmitting Eastern equine on the rise from the previous drought recovery. So last year we had a complete drought recovery. It's a swamp mosquito. It relies on groundwaters and hummocks in crypts in swamp areas, and those were almost completely dry during a few years past, so it brought our EEE activity down and population densities down. We're currently seeing a trend towards an upward increase to another EEE year. So we are aware of it. We're keeping an eye on it. So far,
Interesting to note, too, that back as far as September 3rd of 2008, every positive mosquito pool from North Andover has only been West Nile virus, not any EEE. So you're lucky in regards to that, I guess, you know.
yeah,
But
usually-
it's not to say that you know, never say never. But we are looking, like Kim said, at swamp areas, red maple swamps, white
finding
cedar
new
swamps.
sites, and we're always looking for new
Yeah.
sites. And
They're full of water right now.
Yeah.
So with the drought the past couple of years, those populations, Culicida melanura, were really reduced. They're in the crypts or the hollow areas under the trees within the root system. That's how they overwinter as larvae. And Kim can tell you more about that. But because of the drought, a lot of these places dried up. So that kind of decimated their population. But we've seen an increase in them late last summer. Collection started to rise. So, and again, like I said, with the those areas, you know, full of more water now, it's the potential is there that we could have, I won't say an outbreak, but, you know, see some activity in regards to EEE, so.
And activity has kind of started in the southern part of our district. There's a huge swamp in southern Massachusetts near the Cape. It's usually kind of a earmark as to what we see for EEE activity in the state ourselves. That's where the 2 mosquito pools came from this year, and another one was up near the Vermont-New Hampshire border, and towards, well, a little bit past central Massachusetts district. And those were 2 mosquito pools that were positive for Eastern equine, and there were 2 animals, a turkey and a horse. And the turkey was up near the New Hampshire, Vermont, same place where the mosquito pool was. The horse was down in the southern part near that large swamp. So they are starting to see some activity. I just went to a conference on EEE. Basically, we're on the alert to continue some increased surveillance for that. But we had 0 EEE cases in humans. For West Nile virus activity this year, it was the highest the state has seen in its history of West Nile virus activity. There were 49 West Nile virus human cases statewide. We had 9 in our district. Most were travel related. We only had 1 that was kind of non-travel. 0 in North Andover. And there was 1 death, not in our district, but it was in the state. There were 579 West Nile positive mosquito pools statewide, 18 in our district, 2 in North Andover, and 3 West Nile virus animals statewide, 0 in our district. And if you look at the maps, you can see that the West Nile virus focuses around the same areas every year, give or take a few municipalities. We're seeing a decrease in our district, even though we have statewide increases total. So that's kind of good. A lot of our catch basin treatments in the southern part, when I came here in 2015, we started focusing on the southern part outside Boston, plus the area surrounding Lawrence. Lawrence isn't in the program. So we have catch basin treatment protocols where we hit high-risk areas first and then spread outwards as the season continues. We work with local DPWs to schedule cleanings and other things that help treat those areas so that when we treat using our larvicides, it's more effective. We did have a really big decrease in North Andover this year as far as those mosquitoes. So a lot of times that we can't stop them from flying in from other areas. Let's go to the next slide. So again, mosquito collections in our district were down 3%. Down 3% district-wide. And then we had 24% less mosquitoes collected in North Andover than the year before. And we treated about 60,000 catch basins in the district. 3,500 of them were in North Andover. We completed 1,586 adulticide requests. 5 were in North Andover. They were Board of Health requests because North Andover is a Board of Health request only. We don't allow resident requests. Well, you don't allow residents to call in for spraying. We also take resident and Board of Health larvicide requests, property inspections and things like that. We did 2 in North Andover, trying to expand that by doing some public messaging. And, you know, if is it Stephen? If you get calls where there's people that calling about containers or things on their property, you can always give, or abandoned pools, houses that are abandoned that have swimming pools, give us a call or send me an email or send one to him, and then we come out and we treat it with a long-term larvicide that'll last all summer, so we don't have to worry about that property again. And then we can also, residents that aren't, you know, we can enter property. So if it's something where I can just drive up, enter the property, check, treat, dump, leave a door knocker, follow up with you, or CC Bryant, it'll be good. So we'd like to see an increase in some of those requests to handle some of those urban property problems. We completed emergency block adulticides. We don't do citywide adulticides anymore. We do block area adulticides that target specific areas that are the positive mosquito pools, the supplemental traps, which I'll explain later, the populated areas, the school areas. That's where we want to focus a lot of our efforts to reduce virus risk in a municipality. We did one in Haverhill, but Haverhill, North Andover, Saugus were also in response to positive West Nile virus events. So those are the only towns we did. We did Methuen too, didn't we? Yeah, we did.
Yeah.
Yeah, so we did Haverhill, North Andover, Saugus, and Methuen this year.
All kind of blends together.
Yeah. So this is North Andover's West Nile virus response by timeline. So we start trapping May 15, and I start sending pools in June 1st. And we send them all the way till October 1st. So every week, and I'll go through those real quick, I'm trying to keep this brief, but this is the timeline of what we did in response just to West Nile virus activity. So on 8/29, we got a mosquito pool from a regular trap, and that's Culex pipiens. That species is primarily a bird feeder. So when we get those, it's just an indicator of West Nile virus activity in a town. It doesn't necessarily mean that it's in a population that could pose a higher risk for humans, because we're looking at different mosquitoes for that. What we end up doing is we set supplemental traps in high-risk areas that trap for mosquitoes that may feed on birds and humans, which may transmit West Nile to humans. So with that supplemental trap, we send those additional mosquitoes to the lab, wait for results to come in. If we don't get any, we still have our regular traps, and that's what happened, is we didn't have any positive findings in the supplemental. We ended up getting another in Culex pipiens the week after, and then with surrounding towns seeing their supplementals and traps positives, we made a decision to do a block adulticide, preventative, response. It was mostly preventative, but it was in response to an increased risk for West Nile virus, even though it was only in those bird-biting mosquitoes. If you look in our integrated pest and vector management plan, last year I followed the state's guidelines. It's a color-coded, and it's color-coded to match the state's color-coded risk. So when the state raises the risk to moderate, it's a yellow. So in our plan, we decided, so basically you can turn to that page and you can look and say, okay, the state's risk right now, or our risk is yellow. You can see what the results would be and what our response as a district is. So it's pretty clear. It might vary a little bit, but that's kind of what an expected response that you'll see. Sorry, it's not in that one, it's in the big one. You've got one of the big packets.
They're all put together right now.
So this is on our website. This is the, I create this every year. This is mandatory. It's an emergency integrated pest and vector management plan. So here's the color-coded phased response to West Nile virus isolations. And there's one for Eastern equine too. Oh, you got it, okay. Yep. So in that, if you follow through, the color coding kind of matches, like the blue is what we start at every year. It's low to no risk. The next color code, no risk is blue, low risk is monitoring, it's green. Then we have the yellow. So we tried to match it up to what the state does. So basically, when we saw 2 positive findings from the town, we decided to up it, and there was, plus consulting with us, we decided to do a block area spray around sensitive areas that were at higher risk. And then we also included the schools' barrier treatments and stuff, schools, parks, recs. Some of the schools, park, rec barrier treatments, and I'll go over the products, we want to eventually kind of move up as preventative instead of reactive, so we can discuss that over time. That's more of a 25-day product that we can apply around the borders of properties, and it can last that long, so it may help as just a buffer for the extra control. So kind of, NEMMC is a historical, we've been around for quite a while, since 1950, yeah. So we work on integrated pest management, which is the plan that you see. It's an effective long-term plan that discusses our methods as far as integrating all kinds of different actions to control mosquitoes. It's not just pesticides, it's also surveillance. We do use pesticides. We have physical control. We use biological controls, which are still registered pesticides, but they're more of a bacterium. And we have education and outreach programs. This is just a quick schedule of our activities. A lot of people ask us what we do in the winter. We do quite a bit. So you'll see blocked off things that we do in the course of a season. Of course, our summertime is our busiest time of the year, but we do a lot of maintenance, and we still do surveillance and other treatments during the winter as well. For the Crips, Melanour can be treated during the winter as their larvae in the winter. So there's still some things that we can do off-season. So as part of our surveillance program, we have an adult surveillance season. It starts the second week in May till September 31st. The state lab testing is June 1st to September 31st, unless they have a high West Nile period. Then they can ask us if we'd like to continue doing surveillance. Sometimes we stop. The reason we don't continue state surveillance and sending them in, because if we send them in and we get a positive and the temperature is below 55 degrees and we can't spray, it sends out a message that you still, there's nothing we can do, so it's pointless at that time to keep having positives. But during the season, when we start seeing a lot of West Nile activity, our main messaging is repellent usage and personal protection across the board. That helps everybody. We can't prevent it, we can reduce the risk. Only the person can take care of themselves and wear repellent and protection can control if they get bitten or not. So our messaging for West Nile and other mosquito-borne and tick-borne diseases increases heavily, as well as the state. So we do send out some public messaging, and at the end of the slideshow, you'll see some of the public messaging that went out this year. We have a CDC trap, gravid trap mix. The CDC trap, I'll show that later, operates 24 hours during a collection period. We do once a week collections, and then we have resting boxes for eastern equine, and we check those once a week as well. We tried to get it earlier for the state lab. The earliest, we're in rotation with other districts, and they also picked up another district. Pioneer Valley is becoming a new district. They're far west in Massachusetts. With that, we're hoping we can solidify our schedule Friday morning before 10:30. That's why I didn't want to mess with the schedule, because if I go in the jungle, we may get shot out, and then it'll be later on Friday. So we've got a slot, and I want to stay in it. So that's kind of why that was a question that was asked if I could change the schedule and of results, and we can't.
I've been begging for years.
Yeah.
I got it earlier. It used to be 1:30 p.m. Now it's 10:30 a.m. So we do have more time this year. Yeah, it's before noon.
Kim mentioned too about the new district, Pioneer Valley, Amherst, Hadley, that area, Northampton. There essentially until, last year they kind of founded it. There was no mosquito control from Worcester to the Berkshires. So the whole central section of the state had no mosquito control. Private companies, yes, but as far as communities like North Andover, Georgetown, Boxford, being in a program, a state program, they didn't have one. But now they're kind of ramping up, and they're doing surveillance, and the state did some trapping there up until this point, and they did have positives, horses and a lot of birds and positive mosquitoes, turkeys. But now they're getting on board with a state system out there, so it's better, more coverage.
Great.
So.
So here's what the traps look like. The top trap is a gravity trap. That one's set on a pole historic with the CO2 trap in a location that hasn't changed and probably won't, because the CDC wants to see consistent long-term mosquito surveillance, and we can project things that happen based on history and other things. The gravitrap up top traps the bird-biting mosquitoes. That's our early indicator of West Nile virus in the area. The trap above it, which you'll see on the far right, is a CDC CO2 light trap. That one collects mosquitoes that bite mammals, people. And it'll also collect mosquitoes that bite birds and people, which are the ones that are higher risk for transmitting West Nile virus and Triple E to humans. Those are collected once a week. Those are what's sent regularly. We do have new ovitraps. The ovitraps are here to collect Aedes albopictus, which is an invasive mosquito that, remember the Zika thing that went around? That was the mosquito that was implicated. Zika is a travel disease. It's not endemic here, but it has the probability of being able to transmit other diseases, so we're on the lookout for it establishing in the northern part of the district. It has been established in the south of Boston. It's established, and it overwinters, and that was announced this year from the Massachusetts Health Department. So we have traps out looking for that. We did find it this year in Manchester by the Sea. So we're extending our surveillance around that area, one mosquito, but we want to stop one before it becomes 100. These are our resting boxes. These are only set in areas where the Triple E risk is higher in the district, usually in the swampier northern areas on the New Hampshire border. It's kind of funny because New Hampshire blames us, we blame them for Triple E, but either way. So it's just a fiber pot that goes out in the woods. We have a line of them. They're collected every day in the morning. We get basically 3 species of mosquitoes, Anopheles, which can also transmit diseases to humans. They're known for malaria transmission. And it has the Culiceta melanura, which is the primary vector for eastern equine. And we do our supplemental. So these are the high-risk areas. We place them a radius of collection, distance from a historic trap. We look at topography, human population density, bridge vector potential. Bridge vectors are the ones that transmit Triple E and West Nile to humans. Schools, parks, recs, wetland, wooded, shaded areas. So all these combine together. So when I go out on a site or I look at a map and then I go to a site, I kind of look around. It's a feeling. I just know where to place it, where I can get the best security, coverage, a lot of mosquitoes, that type of thing. And those extra collections are sent to the state lab. Biggest part of our preventative program, which we push this off in, larval surveillance. If we can do larval surveillance and larval treatment and we get them before they become adults, it really solves a lot of problems. So we work really hard on doing our spring larviciding, our melanura site larviciding, our catch basin larviciding, so we focus on pest and vector species, and then everything else in between. So, there's a lot of pest species, but the spring ones, depending on mud season or how wet we have snow melt pools and stuff, we dip before we treat. So vernal pools aren't usually treated because they have the equal share of other organisms. We need a high density of larvae to treat, and other sites will have the larvae. Your vernal pools will have your other organisms, so we keep going and we treat sites that only have a high density of larvae. So that's the other thing. We check freshwater wetlands, retention ponds, abandoned properties, and we have a regional aerial salt marsh program where it's on the coast. It's Ipswich to the New Hampshire border, and it's about 3,500 acres. We've been doing that for several years. It does help the entire district. If we don't treat it, we start seeing salt marsh mosquitoes this far. And in fact, I will collect a few all the way, Methuen, Andover, North Andover, coming up the Merrimack Valley on occasion. So if we didn't do some of those programs, depending on any wind currents, these things can fly 50 miles or be carried on wind currents 50 miles. And they're extremely aggressive. They're not known to be vectors of any disease, but they're a nuisance. They're a really bad nuisance mosquito, daytime biter.
Then they fly back to the salt marsh to lay their eggs.
Yeah, or salt houses,
they're
or
strong
yeah.
flyers, daytime biters.
And they puddle jump, so they can, if you have a salt house that rains and you have a puddle of salt, they can lay eggs there and hatch there every year. They can just keep having generations in a salt pile. Our catch basin larviciding program, I mentioned it briefly. It's an integral part of the West Nile virus program. It interrupts the early season transmission in birds. So birds come in infected, just a few. These mosquitoes breed first thing in the spring and early summer. They'll bite the infected birds, and then they go feed on other birds, and they create the amplification. So you'll have 5 birds come in. Within a week or two, you may have 500 birds that are positive. Then it sets the stage up for those birds later in the season to get bitten by the bridge vector mosquitoes and then bite people. So that's why it takes a progression. Usually we see positives July on because it takes the May and June to amplify it in the birds. So we target certain areas first that are high risk, which is the areas around Lawrence and the northern areas are from Boston. Another question that may get brought up is when we're doing these treatments, why don't we use all natural botanical products? There's several reasons for that. Natural products may not always be safer and still require caution. It could be anything from bleach. Bleach and some oils are natural products, but they don't have the FDA list, they're exempt from EPA registration. And EPA registration is important because it fully tests the product, does a risk assessment, sets tolerances, has label directions and cautions. It requires training on our part to train for those labels and that product, including safety data sheets and product ingredients. It can be revoked. And in emergencies, we have to report any spillage or usage or anything. So having an EPA registration also includes strong provisions for protecting infants and children, which is part of the Integrated Pest Management Plan. You'll see we have 333 CMR 1408 or 1400. I brought a copy. I can give that to you. This is the entire 1400 CMR 333. Schools have IPM programs. We're not allowed to treat on any schools without an IPM, an outdoor IPM plan. So before every season, so that if we have an emergency, we have to do barrier treatments or larviciding and things like that, the plans for all the schools and daycare should be kept up to date with products, which we give information that can be contacting us, and we can give assistance with the product names. That way, in case of an emergency, we're not scrambling to get an outdoor IPM plan for a school done. Also, it reports cumulative effects on toxicity exposure studies and in the Endangered Species Act. Massachusetts also goes through a registration process and a toxicity study for every product before they allow its registration in Massachusetts. So the main reason why we don't use all natural or botanicals is 25B is an exemption. It's the FIFRA exemption from pesticides. Condition number 5, there's a whole bunch of other conditions like labeling and stuff. The main reason we don't use them is because public health claims on these botanical products, non-registered, are prohibited. Our entire district, if it's not pest control, it's disease control. We have to apply products that can guarantee some reduction in the risk of vector-borne disease. So that's why we have to use some of these products. So these are our products. We use larvicide products. None of these are restricted use. They're all category 4. Very simple to use. They're not high risk. They're not highly toxic. They're very mild products. We use bacterial larvicides for certain things. We use insect growth regulators. We only use those in containers and stormwater. We don't use them on wetlands. We don't use them in freshwater sites. We don't use them on any ground dwelling anything. That's just our choice as a district. We prefer not to use them. There are some Natural Heritage Bureau restrictions on methoprene. We just go across the board and we say we're not going to use them in any site that's not a container. Which are alticid products. So we use them in catch basins. If we don't use bacterium, we'll use the methoprene, but that's stormwater. We also use mechanical suffocants. There's a cocoa bear oil that we use, or BVA. It's mineral oil mixed with some coconut oil. And what it does is we use it at a specific time. It's used for pupae, which other larvicides don't treat because they're not feeding. So this actually has to kill them at the surface. So we suffocate them. Basically, the product lasts 4 days, suffocates all the pupae, and then we don't have to retreat again. These are our products for adulticiding, same thing, they're category 4. We do barrier treatments using Suspend SC, and it's a deltamethrin product. It has quick knockdown, 21-day residual barrier control. We treat it on vegetation. You have to have a vegetative border around something to treat it, though. If it's wide open, like a soccer field with no trees, there's no point in applying a barrier. There's nothing for it to stick to, and the mosquitoes don't crawl on the lawn, so they need to have something to fly through in order to touch a droplet to die. All our products that we apply for adulticides are applied a half hour after sunset. The reason we do that is to make sure the bees are hived And that's just another thing. Our only requirement is to apply at sunset. We chose to extend it an additional half hour after and a half hour before sunrise. That way, the bee population is definitely hived. For our registered, the other pesticide we use is Zenivex E4. That's what we use for the emergency street spraying. And we chose Zenivex E4. We do have Duet as well, but we switched over to Zenivex. Duet's being reformulated. Zenivex has no PBOs, no synergist, and has a high efficacy. It's literally 1 ounce. I should have brought my box, but it's literally 1 ounce of product for an entire football field. So it does have, it's a very minimal use for a large area. It's really quick. It only has a 15-minute knockdown. It's in the air 15 minutes and then dissipates. It doesn't go on the ground. It just literally, that's why we have a temperature control. So we have to be above 55 degrees to apply this product, or else the droplet size it won't work. But it's only in the air for 15 minutes. There's no residual. It does a 300-foot swath from the back of a truck. Again, it's a half hour after sunset. And again, this product is based on temperature, weather, and mosquito populations. That's why we consult when we decide to do it first. This is the school IPM I mentioned. We also do residential pesticide exclusions. That's on our website. It's also on the documents you have. The residents can click on those, and they can fill out the online form. It goes to the Department of Agricultural Resources. It gets forwarded, depending on address, to the appropriate districts. We enter it in a database. It gets logged into our GIS system. So when we're doing adulticiding, it automatically gives us a huge warning in our vehicle to shut the sprayer off, and then we continue on when we're doing that. So we do take into account these exclusions.
It works off the tax parcel, so,
Yeah.
you know, if you've got, say, 2 acres, it shows that on the map as the tax parcel in bright red. So you'll get a visual and an, audio alarm that you're approaching one of those no spray areas, to shut off. So it's a really good system.
And we do mention to people to do it way before. They can do it from January 1st, and it lasts till December 31st of a calendar year. We recommend not to do it when there's a spray announced, because it does take 14 days. It does not become in effect until 14 days after they send the application into the state. It gives us time to get it, enter it in our database. So we do have a couple people that tend to fill out a request and get it to us when we do a 72 or 48-hour notice or whatever it is, and then we see requests coming in for that town. We can't, we spray them because we have to wait the 14 days, and then they're applicable. So far, you guys have 6 that came in.
Yeah, that's it.
And property inspections. So under Chapter 252, which gives us authority to enter property, not regulatory, but it gives us authority. We don't push it. If they don't want us there, we leave, unless it's a Board of Health issue, and then we call the Board of Health, and we try to meet on site and figure out what goes on. But we don't push residents to we don't force them to do anything. If they don't want us there, we figure out a different way.
We're not regulatory.
No. But we do have the right to enter property, private property. The other thing we do as part of our IPM is mosquito habitat mitigation. You can petition us to do a project, a wetland project, mechanized. There has to be a mosquito component required. So we go out and assess if you have a site in mind, like if there's a backed up storm system that goes into a retention pond and it's flooding a neighborhood or something to that aspect, and it's breeding a lot of mosquitoes. It's a problem that has to be fixed, because larviciding it really isn't, it's a lot of larvicide. It's going to be a lot. So it would be easier to mitigate that by doing something with a wetland or something with mechanized, management.
Yeah.
So you can actually just send us on a letterhead what can you look at this site? We give you authorization, what can you do, get back to us. And that's pretty much petitioning us to go look at it, and then we make a decision, get back to you and say, yes, it qualifies, no, it doesn't, that type of thing. We do hand ditch maintenance. We have books that we go out, we do every spring when we're doing spring larviciding. We take leaves out, we remove brush and trees out of ditches and some wetland areas that have natural stream flows. That's a normal process we do, so we do a lot of that.
We have a list, for each town of sites that we visit, historical we're adding to this all the time, you know, when the technician is out visiting sites, may come across another retention pond. I know a lot of developments that go in, certain drainage is required, whether it be a, you know, retention basin or a detention pond or something. And so, you know, we'll be riding down the road and see a new area, and, oh, they've got 3 ponds in there, that, you know, and we'll stop and check, and they get added to the list. So as another breeding site, so.
And so far, you guys have 33 sites that we visit on a regular annual basis, not including other sites we find, but these are big log sites that we actually check and treat. We also have a tire recycling program. You may not participate. We've offered a couple of years in the past. During hazardous waste days, we'll bring our rack body truck over. We'll have public education. We'll pick up tires without rims that people dispose of so they don't end up in the woods. So that's something you can remember too. We have a couple scheduled. We have Beverly coming up. We have Andover coming up. We picked up Lynn. Rowley.
Yeah.
So we're trying to get maybe 1 or 2 here and there just to keep it so that we can keep a schedule and not get too many all at once. We do pick up the tires in the woods. If we run across them, we pick them up and dispose them. So if you ever see on your BMP that there were like 4 tires removed from North Andover, that's what it was, is we picked them up from the side of the road. We have a website that was developed a couple of years ago. It's extensive. Everything you need to know is on there. All our annual reports are on there. Resident exclusions are on there. Soon, we're going to have it so that residents can go on and even get requests for us to inspect properties by typing it in. It'll come to our new Field Seeker program, which is all on our app. We have apps now that we go out and we can do polygons, points, and lines for all. We can do catch basin treatments. So everything's going to be logged in a database for future use, for maps and other things, treatment. Like if you say, well, this site here, it had larvae, how much product did you use? When did you treat it? When did you go back? We're going to have all this data, which is very handy. So we're going to have a link to some of that on our website for the information. We have all our announcements that we have. We have nice pictures, and we have good breakdowns of our information for our surveillance and stuff like that. So if you forget something or want something, you can go on there and look at it. Public outreach initiatives, we do a lot. Everything from spending 45 minutes for a resident that stops us on the side of the road and asks us what we're doing, to answering phone calls, to answering emails, trying to do, you know, these presentations. So it's the next time you get asked by someone, you'll know a little bit more than, I don't know, or we don't know what they do, or this is what they do. You know, you'll be able to get some more information. We've also done, one of my field techs, Kelsey, we were requested by Winthrop to go down, and with Astrid, who's the Board of Health Commissioner, we did a What's Biting Me. We did a podcast. It was an hour-long presentation that's on their WCAT TV. So it was viewed on YouTube X amount of times, but it's a presentation that you can watch. It's actually pretty neat. So it describes the problems we had in Winthrop this year with the salt marsh mosquitoes that we didn't have. They flew in from other districts. And so we had that problem. Plus a little bit about virus. It was helped with the public health department. Matt Osborne gave us some information too. So it was kind of an hour long like this, going through PowerPoints, discussing what we do, just kind of as public outreach. We also have in front of you, you've got yellow door knockers. We redid those again this year. When we go to a resident and we treat or we just visit the site, we leave one of those, fill it out so they know where we've been. It has educational information on the front on how a homeowner can reduce breeding in their house. And we did it so that now it can be perforated at the bottom and kept like a business card. So they can actually just keep it and put it on their fridge, put it in their wallet, so they have our contact information. And I don't know if this is going to play, because I think it might have separated, but Manchester by the Sea did this year. Whoops, I don't know if it's going to work.
Not that.
Oh, I sent it. I don't know if it's going to open. Well, anyway, it was a video that when they started having positives, they rolled out the DOT sign, you know, the nice billboard that they have on wheels that has, they put mosquito season, wear repellent, protect yourself, dump containers. And it kept repeating itself, and they put it at the 2 exits, because Manchester on 128 has pretty much an on-ramp and an on-ramp. 2 entrances to their town. So we're actually going to try to get it, and we don't want to overstimulate the public with a lot of messaging, but this did help just give, when it became apparent there was a problem in that area, the Wenham Topsfield, because we had a lot of virus a little bit cornered in that area. They put this out, and it's just enough to give people that awareness. And so it's an idea. We take these ideas seriously. They're great ideas. So now I gave it to the state and said, the boards that aren't being used on the highway for snow and inclement weather, it would be nice if we had a really bad season to shine, wear repellent, something, triple E season. So these ideas we use them. They're helpful. We do school presentations. There's all kinds of things that we can do. So we're really trying to get out there. We gave a presentation to the Essex County Beekeepers Association in Topsfield. And after years and years of not wanting to see us, now they want us to come and do a road show with them. So basically we kind of have the support of the beekeepers now because of the way we're presenting and the way we're educating and our methods and science and everything behind what we do. So that's it. Any questions?
The first infection of an infected mosquito was August the 28th
Yes.
last year. What are the symptoms if you have a West Nile infected with West Nile virus or East and equine encephalitis?
I can give you some brief ones, but any kinds of health questions, I'm not the epidemiologist, so we can deal with mosquito stuff, but I can give you really quick. Basically, it's fever, chills. Sometimes it depends if it's neuroinvasive or non-neuroinvasive. So depending on what it is, it can develop from West Nile virus fever to West Nile virus encephalitis. And that's where the increase in fatalities may come from. So basically, it's kind of the flu-type feeling in the middle of summer. You may not even know that you have West Nile. You may get it, be fine, get over it, and not even think about it. If it's neuroinvasive, it can become an encephalitic infection, which may require hospitalization, and that's inflammation of the brain. So, but the risk is lower than triple E. Triple E is pretty much right away encephalitic infection, and the risk is a lot higher. Out of people infected, 80% chance of fatality with triple E. With West Nile, very low. And triple E usually infects the poor immune, young, and very old, whereas triple E can affect everyone.
And you said last year there was one fatality in Massachusetts. Tragic, but isn't Lyme disease from ticks even worse?
All diseases from ticks, there's 9 tick-borne diseases. We don't do ticks. It's not within our mission or legislative, so we'll never be able to do ticks. I used to work with ticks in Maine and New Hampshire for a long time. There's a lot of tick-borne diseases. Some can be co-infected. So like I had Lyme with anaplasmosis. You can have Babesia. There's Powassan, which is deadly. Lyme disease and some of these other ones, Lyme can be debilitating long-term. It does cost a lot of money for the people that become sick long-term. That's why we push repellent usage all the time. Repellent, repellent, repellent. Protect yourself when you're outdoors. It can be on the side of the road. You can get bit by a mosquito and pick up a tick. Your pets can get bit, get heartworm. You could pretty much, ticks are hard to control because they're everywhere. We don't have the authority to go in everybody's backyard, treat everywhere for ticks. It's very difficult. But that's why we do push personal protection and repellents. And repellents that state on the label, therefore West Nile and Lyme, or mosquitoes and ticks, that are CDC-approved repellents. And you can go on the CDC's website, and they give you a list of repellents, everything from lemon eucalyptus all the way to DEET. There's different kinds. There's clothing treatments such as picaridin and permethrin that last 30 washes. So realistically, it kind of falls in the hands of the person recreating to be able to protect themselves against these diseases, no matter if they're mosquitoes and ticks.
Now, correct me if I'm mistaken, but I believe you can be infected with a tick any time during the course of a year, whereas mosquitoes is just later in the summer through part of the fall. A tick is a different story, and I had read that, 300,000 people have Lyme disease every year. I forgot the number, but it's staggering.
Yeah, and
I believe ticks have a 2-year cycle.
they have a 2-year cycle, but again, you'll find nymphs any given year. So you'll have a year of nymphs, and then you'll have adults together, and then the next year they kind of overlap. But in the wintertime, they are on animals, or they're under leaf litter. So, usually it's hunters and that type of thing that will get the ones in the winter, like the winter months where there's snow cover. It'll come on animals, it'll be on deer and birds. A lot of times the cases that come in the winter are cases that they got infected during the season, the fall, and by the time they get clinically diagnosed, it's now winter. So they use the diagnosed date. They don't use the onset date for some of these. So that's what you have to look at when you look at when you get Lyme or anaplasmosis or babesia or powassan or lichlia or tick fever. You have to look at actual when it was reported versus when the onset was.
Remember last year and the years before then, looking at the amount of resources that certainly the state and federal government has towards address illnesses from mosquitoes. I mean, it's a lot of money, many millions of dollars. And I think Massachusetts last year was like $25,000 for ticks. I don't remember the number, but not much money at all. Are they gonna look into the problems? Because it seems to be getting worse.
Oh, yeah.
Right, and we do have on our website.
A lot worse.
On our website, you can go to a link for ticks, and it'll take you to the appropriate state divisions that handle tick research, tick ID, tick everything. So because we get asked this frequently, and again, it's not in our legislative action to work with ticks. So all we do is we give you information to you so you can go call the appropriate state departments that do deal with ticks.
I have a question for you. We know that West Nile virus, its off-season reservoir is like the birds, the migrating birds. What's the off-season reservoir for the triple E?
That's difficult. They're still working on a lot of it. Sometimes they did deer and moose serosurveys in Maine and Vermont, and they actually find that the deer and moose population have tested positive in a sero sample for triple E. So they don't know, it's not a reservoir because it's a dead-end host, but in order for those populations to have it consistently, they have to get reinfected every year because Eastern equine it's not like West Nile. Once you have West Nile, it causes some sort of immunity. Triple E, you have to keep, you can get reinfected. That's why you have to have your horses vaccinated every year.
Oh.
So they're not quite sure. They're thinking maybe turkeys. They're looking at reptiles. They're looking at birds that stay in the north stay in these swampy areas, wood grouse, maybe non-migratory birds that are resident, and they're holding some kind of resident triple E viral. I mean, there's a lot of strains of it. So they're also looking at different strains and what those different strains are doing, whether they're the one that's active locally is one from the south, or if the one that's active locally is one that's in a resident population of birds. It's so unknown, so we look at different things, and they're constantly working on it. So we have Connecticut Agricultural Experimental Station is looking at it. We've got Cornell looking at it. That's where I went to the Triple E conference. So there's a lot of different agencies that work on these studies every single year to do serosurveys. They do genetic studies, that type of thing. So
It's just interesting to me that the epicenter in Massachusetts for triple E is like Bristol County.
Yeah.
And then the epicenter near us is Hampstead, New Hampshire. Why?
big swamps.
Big swamps.
Huge swamps. That's where these, they're hard to reach, hard to treat, very dense. The birds like them. They offer great protection. Tons of crypts. Old swamps. They're very old, deep crypt. They don't dry out very much. What's the name of the swamp down in Hockomock?
Yeah. There's an
Prime
overlap.
target. That's
Yeah.
it's and that those two areas that I mentioned, the triple E and the turkey, and then the triple E and the horse. Those are those areas, and that's why they're trying to get the Pioneer County to kind of get up and running because of this, the problems they may have more so from triple E than West Nile. And Vermont now has statewide coverage. They used to only have the big swamp they had near the Lake Champlain border. Mm-hmm. Now they're sampling the entire state. All towns have traps for triple E surveillance, and they're finding the same thing, that their deer serosurveys and moose serosurveys follow their high instances of triple E, but they don't have a lot of human cases because the swamps are so dense and low populated with humans, that you don't see a lot of human cases. When it really explodes is when you see the outliers of human cases that spread outward when they have a really high triple E year. Triple E year.
You're absolutely right, though. It'll show up down in Bristol, Plymouth
Yeah.
County, and then it'll skip over us and it'll be in New Hampshire. And it's like, well,
Yeah.
there's a big area there. But eventually it migrates in,
And it all depends too where the birds
moving,
come,
yeah.
because if we have a rainy season in some areas, they may continue north to nest, and that's where we get the spot like near Orono one year. There was a huge 5 horses, tons of mosquitoes, and then it never showed up again. So the migratory birds just happened to not stop and kept going till it was dry so they could nest, So you'll see some variations in those things. So between the swamps, the migratory birds, whatever's happening, it's very, very variable.
Well, thank you very much.
You're
This is
very welcome.
helpful.
Good seeing you guys again. Thanks, I appreciate it.
Thanks for coming out.
Thank you.
We'll be working closely with you all
Yep.
season again.
Yeah. And think about, I'm sure you must have a zero waste day or hazardous waste.
Yes.
Do you collect tires or not at
That
this
is run
point?
by the DPW, but I will reach out to them.
Okay.
I made a note to myself to see if they do recycle tires during that day.
Because I work closely with Mark Fournier from Andover
Yep.
every year, and
Okay.
we do the zero waste, which is coming up,
Yes.
I believe it's May 4th.
Okay.
But, we throw it out there to all the towns. If you
Okay.
don't, some towns don't even accept tires, but we'll offer that to that
Love
town,
service. Yeah, I'm gonna
that
reach out to them
service.
tomorrow and see what their schedule is.
Yeah.
We just had an entire meeting 2 weeks ago on crumb rubber.
It's the exact same thing.
The other side of the recycling the tires.
Yeah, right. But tires are a big breeder. They're the
Yep.
perfect container. They're
Yeah.
black, they heat up, you can't dump the water out of them.
Yeah,
So it's, it's a tough thing to deal with.
it is.
Constantly have to treat them. Might as well just get them out of the stream,
Yeah,
So I think one more question. We did not publish your best management practice plan
Correct.
yet, because I wanted to make sure through the course of the meeting, there wasn't anything else you guys want to edit, change, or, so if you want to just talk about, go through it real quick. If there's no changes, email me.
Okay.
We'll publish it on our website.
Yep.
If there are changes, I can make edits, send them back to you for review, and then
Gotcha.
on and on.
all right, I didn't see anything that was gonna change, but
Yeah, no, we've
I
had
gave
the,
you guys the last meeting, so.
I mean, I know it's kind of a relatively, there's been some changeover on the board. Joe and I were here when this was being developed, when it was a lot more kind of politically active, and, there was, we came up with what we thought was something that fit the character of the town, and I don't see much reason to change it at this point. It seems to have, over time, proven to be a valuable tool that we don't mess with unless we have a reason to. But that's kind of how I felt with
Yeah,
it.
me too.
But this
Anything
did get a lot of discussion a few years back.
Yeah.
So it's evolved mostly because it seems to be, it kind of threads the interests in town.
Okay. Be in touch.
Great.
Thank you very
Thank
much.
you.
It was
Thank
nice
you.
meeting
Coming out.
members of
It's
the.
great having you back again.
Thank you.
Yes.
Anytime you need us, we're here.
Don't hesitate to call, too, if you have issues with properties or,
Believe me, I don't.
I know.
I know. Or emails, long emails, no, yeah.
Some of them, maybe.
Oh, it's all right.
Thank you, guys, appreciate it.
Thank you.
Very much.
Next item on the agenda is our new community support coordinator, Deanna Cruz. We appreciate you waiting and listening, and please, wherever you're comfortable, whether you're at the lectern or at the table.
That was so scary. Oh my gosh, I'm never leaving the house again. in
Well,
this
not without
weather.
repellent,
Wow.
anyway. So please introduce yourself and tell us about what you do. I know that we've met, but...
Yes, yes. Well,
maybe
thank
the
you for
other-
having me. I have met a couple of you on the board. So my name is Deanna Cruz, and I am the not-so-new, I have now been here 6 months, community support coordinator, first ever for the town of North Andover, which is very exciting. In the 6 months that I've been here, I have done a whole bunch of different things, which is really what the position was intended for. I have had interactions with well over 100 residents on a one-on-one basis. So a little bit about myself. I'm a community psychologist by trade. In my previous jobs, I have specialized in addiction treatment, in prevention work at the community level. I have also worked as an adjunct professor at UMass Lowell and Middlesex Community College. And I still currently work as a clinician on the psychiatric crisis team in Nashua and periodically in Manchester as well. So I have worked with, or had exposure to over 100 different residents here in North Andover, helping them deal with crises on an individual level or with the family or some kind of issue. Maybe it's with a school or something going on in the community. I've also worked with different systems and agencies in town, have had referrals from the police department, the fire department, different departments here at Town Hall, interestingly, have had referrals from inspectional services, the town council, veteran services, many referrals from the senior center. So it's been very interesting because you may know that historically this type of position has developed in towns as a response to the opioid epidemic and the need to really deal with and address residents who have addiction issues. And interestingly, here in North Andover, that's the demographic and the population I've had the least exposure to in my 6 months here. Really only a handful, less than 5 referrals for addiction issues. The majority of the referrals I've received really have been for senior citizens, the elder population, and folks that are connected to the senior center, but have needs that really surpass what the senior center can help with, which is really the nature of this position. I've done a lot of work with the school department as well, more on an administrative level, working with the administration on developing programming and helping to navigate and meet some gaps in addressing students' needs, which is really wonderful because that's another goal of this position. We've been able to have a couple of workshops back in January around how to identify signs of trauma and what to do if you notice signs of trauma specifically relating to the gas crisis, what to do if you're acknowledging that. So there's really been, it's been a wonderful experience. I've been able to work with the community in many different capacities and have had the opportunity for folks to just drop in here at my office in Town Hall and get support around, immediate crises that they're experiencing, have provided referrals to all kinds of services. So it's been really what the position was created for. So I'm excited as we're moving forward to continue to offer this level of services. It's very clear that, there's the one side of the position, which is about the one-on-one kind of crisis stabilization, and then the other side, which is the more administrative navigating the gaps in service within the community. So I do see in the future this position developing and the department becoming larger and really having more folks dealing with those two sides. So looking forward to that. So questions?
You mentioned opiates.
Yes.
I had read that in Oklahoma, there are more fatalities annually from opiates
Yes.
than automotive accidents. And recently, there was a $270 million suit. Purdue, the manufacturer of OxyContin, I believe, settled $270 million in one state. They probably will go bankrupt. Good for them.
Yep.
Before that happens, I hope we get a lot of money here in North Andover.
Yep.
But that's, and what is it, about 70,000 people or so die annually in the United States from opiates? I forgot the number, but it's
Yeah.
staggering.
Yeah, well, and those are the reported deaths. Those are the ones that we're able to identify.
Oh,
So
wow.
4 out of 5 people who are addicted to opiates began their addiction from a prescription painkiller. And, I mean, think about how often you have been offered a prescription painkiller from a doctor, no offense to the doctors in the room. But,
I don't prescribe painkillers.
okay. You know, it historically was just a matter of practice. You have pain, you get a prescription for a painkiller. You know, luckily in Massachusetts, in 2012, there was legislation to regulate that, so that happens less. Anyway, so 4 out of 5 people who are addicted to opiates began their addiction with a prescription. And even today, so in the fall, in October, here in North Andover, the police department participated in National Drug Take Back Day. And I presented the flyers and made the announcement at the senior center. And some of the seniors said, oh, no, that doesn't relate to us. And it absolutely does. And that's part of the problem, is so many people don't understand that you can be taking a prescription painkiller 100% as prescribed, and you can become dependent on it and go in that downward spiral into addiction. And that's a scary fact. So absolutely, people are still becoming addicted. People will go from a prescription to using intravenous heroin from the streets. And we still have large numbers of people dying.
Do you deal with matters such as vaping in the schools here in North Andover?
Yes. That's something that I've been talking with the superintendent about, and it is a huge problem. I was just at a conference a couple of weeks ago. Vaping has increased over 300% in the youth population. It is more dangerous to our adolescents now than cigarette smoking, and it is almost impossible to enforce because of the marketing and the like the jewels and all the things that are marketed towards adolescents. But that is something that is being looked at, yeah.
I should know the answer to this question, and I'm looking at both of you because I'm not sure who the question's really for. But I'm familiar with other parts of the state where after an overdose, you know, there's a team that'll go out and try to connect with the person. Is that something that's been looked at all for this area?
I'm the team.
You are the team.
Yep. So I co-facilitate it's called the Hub, Merrimack Valley Hub, in Lawrence. We meet on a weekly basis. There are folks from Lawrence, Methuen, Haverhill, Andover, North Andover, and where we follow up with every overdose in every community. There's also, I forget the acronym, but the county has a system that all the police departments are a part of. And when there's an overdose, there's an officer identified in every police department that has to respond within 24 hours, and their outreach person has to respond and has to be documented. So in our community, it's Officer Enright, and he contacts me, and I do the follow-up to offer access to treatment. But we also do that informally in the weekly meeting that we have. Yep. Luckily, there aren't that many instances where I've only had to do that once in North Andover.
I found it interesting that you mentioned a lot of the work that you've done is with seniors. Was that just an unanticipated need that we didn't know about?
It was unanticipated on my part, absolutely.
Or the people that you hired you too, right?
Yes.
So-
And I think, you know, it was the time and the place. So I started the week after the explosions, after the gas crisis. And there are a lot of seniors that are isolated and connected to some basic services, but also still in need of many other support services. And through the tremendous response that the town provided to residents, especially the seniors, we were able to see that there was this need. We did outreach to seniors specifically relating to the gas crisis and did door knocking and were able to identify needs that they had. And that was pretty surprising. It was pretty surprising.
Is that an ongoing need, or since the gas crisis has kind of been winding down? I mean, there's still people who are without their homes, but I think for most people, their appliances and home heating has been restored. Do you still find that, now that that's been uncovered, is there ongoing work in that regard?
To be honest, it's ongoing. The seniors in a couple of developments feel that they were mishandled. Their needs weren't met properly. They feel like they need follow-up and more attention. So there's still ongoing work that needs to be done around populations as a whole, with community building and morale building, but also because of that, the folks that are higher risk were identified and still need the additional support. Which isn't necessarily out there. That's the unfortunate part. I mean, we know that our systems of care aren't always adequate. So it's really about the constant follow-up and making sure people are safe in whatever capacity we can.
The gas explosion, as you just stated, and I couldn't agree with you more, the town did a stellar job
Yes.
addressing it, but it took a while to get mobilized. I mean, it was major in our
Yes.
community in Andover and in Lawrence. I know that night, the gathering point was the high school, and I was there, and it was rough, particularly for seniors.
Yep.
Some of them just looked totally lost.
Yep.
Didn't have an idea what was going on.
Yep.
And as I said in the past, in North Andover, our population is about 30,000, and there were over 6,000 seniors. Every day, 3 more of our residents become a senior in North Andover. And of those 6,000, 9% live in abject poverty. They have nothing. And no support,
Right.
and
right.
no family.
Right.
And the town does all it can to help, and
Right.
the town does a real good job.
Right.
Considering, to be honest with you, the limited budget that we have in the senior center, it's a good job the town does.
Yep. Yep. And one of the biggest things that I have found is people want the social and emotional support. And that's the wonderful thing about my job, is that's what I'm here to provide. So being the person that can listen and follow up and be the social support that a lot of seniors don't have is rewarding for me and helpful for the folks that need it. And something that I'm partnering with Caroline and Brian on is mental health first aid. I spent the whole day writing that proposal. Training folks on mental health first aid so that we will have a team of trained people to have workshops in the community so that we will be able to identify when somebody is in a mental health crisis, whether it's seniors, children, and we can say, hey, wait a minute, there's something not right. I think this person needs more support. And that's critical with our seniors who are isolated and don't necessarily have somebody checking on them, and somebody who knows what to look for in terms of the mental health signs.
Do local hospitals have your contact information, like ERs, case managers for discharges of like frequent rehospitalizations or overdoses, things like that?
So one of the things that the Greater Lawrence Hub that we're working on is having all of the outreach workers for each community credentialed to go right into the ED and do the follow-up right there. Very complicated process with all the HIPAA requirements, but that's in the works, yep.
need for your position was drastically underestimated. It's been great to have you on board. This is phenomenal. I think the work you're doing is fantastic.
Thank you.
So I enjoy working with Deanna, and we're doing a lot of really good stuff. You're doing amazing stuff. So
Thank you. I'm happy to be here.
thank you for coming finally. We definitely appreciate it.
Yeah, anytime. I am happy to come.
And I'm looking forward to working with you on a regular basis. And we have started that already, of
Yes,
course.
yes,
Um,
yes.
But yeah, the need when we did the interview process and what we were thinking was going to be the biggest need isn't by far the biggest need. We knew there's going to be some ancillary needs along with substance abuse and things like that, but she said mental health first aid, the senior population completely took at least me by surprise in talking to you and hearing what you're saying tonight. But that's why it was an all-encompassing position, not pigeonholed or specific for substance abuse and addiction situations. So I think it's great to have that broad range you've taken and kind of run with, which is, I think, the idea.
And I give all the credit to you guys for having the vision to have a broad position, because that was a risk, and it's really what you need. So, thank you.
So what I want to do is just give you a chance. I mean, you gave us your card, which kind of tells us how to get in touch. But
Yes.
maybe if you just for the audience, how do we get in touch with you if we need your help? Do you need an appointment, for example?
No. So my office is on the second floor here at Town Hall, top of the stairs. First office on the right. Folks are welcome to drop in anytime Town Hall is open. However, I may be with somebody or I may be out visiting somebody. You can call me, which I don't know my number. So.
I do. It's 978-794-1703.
That's it.
They can also email you at dcruz, that's D-C-R-U-Z, at northandoverma.gov. North Andover, MA, one word.
Yes, exactly.
And all matters are private and confidential.
Yes, and folks can leave a voicemail, which is private and confidential. Nobody hears anything other than me.
Well, thank you very much for joining us. Thank you for
You
listening
folks
to
have
the
a good
others.
evening. Oh, I know. Oh, I had forgotten about it. Thank you very much.
All right, correspondence, newsletters, any correspondence items?
Just what's in your packet, just to keep you guys up to date on mosquito stuff, the opinion for the Board of Health, Deanna's information, and that's pretty much it for now.
All right. Last item,
Make a motion to adjourn.
Second.
it's been moved and seconded. All in favor, say aye.
Aye.
Any opposed, say no. We are adjourned.